All right, welcome to MeBe's webinar. My name is Carol Rodrigues, and we are going to be discussing our preschool prep program. I'm very excited to share with you tonight. So I am the Mesa Learning Center Regional Director out here in Mesa, Arizona. We recently opened the doors at our Learning Center in February, are very excited about expanding our program, and we are beginning to work on our school readiness program and have open availability within the morning hours and early afternoon as well. So a little bit about MeBe. What is MeBe? What does it stand for? It's really about being me. We want to integrate research-based strategies with intense personal attention to provide therapy that's engaging, flexible, and customized to your child's needs. All our interventions are individualized. Even though I'm going to be discussing our preschool prep program, it is still individualized to each learner. The services we have applied behavior analysis here in Mesa. We also have occupational therapy and speech language therapy available via telehealth. We hope to have late fall occupational therapy and speech language therapy to join us here at the Learning Center in Mesa. We have many locations, so most likely everyone joining us today is from Phoenix, Arizona region. If not, you can check our website. We have many other locations in other states. And we are continuing to expand. It's always exciting here at MeBe. Some areas you can find us. We are on Instagram, Facebook, where you probably found the invite for today. We also have a YouTube channel. We record all of our webinars. We have really great 1 to 3 minute little informational videos as well from our speech and language, as well as our occupational therapy instructors. You can also go to mebefamily.com, where we have a wonderful blog and all our other resources. If you are interested in services, that's a great place to start, is at mebe.com. There's a very easy fill out form that you can complete, and our family success team will get back to you typically within 24 hours. Also, you can call the phone number there on the screen as well, which can also be found on the website. So let's get started for today. I'm here to discuss our wonderful preschool prep program. So we are going to be talking about ages and expectations, reviewing the ages and expectations by using the VB MAP assessment. The VB MAP assessment is a very common used assessment within ABA. If your child's receiving services elsewhere, they probably are already using that to assess their skill levels. It was created by Dr. Mark Sundberg, and it allows us to assess a child's verbal behavior, so their communication skills. But what falls under communication skills in the VB MAP is also group skills, socialization skills, play skills, all these great things. And it assesses the children from 0 to 48 months. So we can start looking at group and play skills as early as 18 months. Play skills we can look at much younger, but when we talk about group skills and school readiness, we can start looking at 18 months. And what the VB MAP allows us to do is it allows us to assess on how much assistance the child needs. So are they showing the skill? Are they showing the precursors to the skill? And if not, that now allows us to be able to create a goal and work on that with them. I'm going to go further into breaking up the skills of what the VB MAP looks at, and that's what we use for our preschool readiness program, because it allows us to give you as a parent feedback on what your child needs support in. So when they're ready to go to school, whether it be a public school or a charter school, you can go in with knowledge on how much support your child needs through this assessment tool. We're also going to be talking about the difference between not the difference, but we're going to talk about natural environmental training. That's really what we focus on here. Is we go by the philosophy that a child needs to be happy, relaxed, and engaged to learn new skills. And that's really using a natural environmental training technique. Well, I'll give you a little insight into our curriculum and what a day at the center looks like. And we can talk about how are we blending ABA and our preschool prep program. So to become a part of our preschool prep program, your child would have a diagnosis of autism and be eligible for ABA services through your insurance. We take most commercial insurances and as well as most Medicaid insurances. So we would create a treatment plan for your child. The treatment plan would include some readiness skills because we would use the VB map assessment tool. And then within our program, not only are they going to get access to a school type feel, a classroom type feel environment, but they're going to have their one-on-one, they're going to have their individualized goals through their functional behavioral assessment, and they'll receive their ABA services in a natural environment with a classroom-like setting. Excuse me. So if I'm talking about the VB map assessment tool, and I look at a preschool ages 18 months to 30 months, we can assess their group skills. Are they able to complete daily routines, like putting their personal items away? Our classrooms have little cubbies. Can they walk in with their backpacks and hang up their backpacks? Are they able to grab their lunchbox and go to the table and sit down to go eat? Are they lining up to transition to another area? Little daily routines that would be expected in a large classroom environment. Then we also have, are they able to sit in a group for at least 10 minutes? So that's a long time, 18 months. Wow, 10 minutes. 18 months is really expected around 3 minutes. These are developmentally expectations. Where your child is where your child is. And it's what we want to do is our job to work as a team to get them up to these goals. These are a goal for them. So a goal for 18 to 30 months is to sit for at least 10 minutes in a group environment. They might only start at 30 seconds, and that's okay. The way our program is set up is all the children would transition to group time where they're doing the calendar and stories and songs and things that you would find at a preschool group time. Each individual child in that group time is going to stay there as long as they're able to. We're not forcing them to stay. So if we know that Michael can only sit for 30 seconds, his BT is going to be making sure around that 30-second mark, they're going to transition them to another activity. They may return for another 30 seconds for a song and then transition back out. That's okay. It's not going to disrupt the group time. Every learner has their own BT with them and they're working on their own group time skills. So they're going to come and go within that 10 to 20 minute session of practicing those skills. Another area that they're going to need is the transitioning between activities. It's expected from 18 to 30 months that they transition with no more than one prompt. So I'm telling Julie, okay, we're going over to the sensory room, time to go. And if she doesn't start motoring over to go with me to the sensory room and I have to prompt her again, I can prompt her one time, come on, let's go. Maybe I put out my hand for her to hold hands and she doesn't move, she didn't meet that goal. That's okay. We can create a goal and work on that with them. We are able to do these within our ABA program because these are also listener responding goals, following directions, that all falls under communication. So when we want to talk about play skills, are they able to assemble toys with many parts, like a potato head or a train track? And then are they able to independently play with these toys for up to 5 minutes? Then your learner might not have the skills to sit and play with one item for 5 minutes. Within 5 minutes, they may have already played with 5 different toys. That's something for us to work with them on building up to. Because in a school environment, even when we talk about them going to kindergarten down the road or first grade, they're going to be expected to attend and play for a certain amount of time on the playground by themselves. Initiate play with peers. That's the great thing about having a group environment and everyone has their one-on-ones. We can encourage and assist and teach them how to initiate play. How do we gain someone's attention? I want to play with that toy instead of grabbing it or pushing the child because they want to play with them. They push at them or growl at them or bark like a dog. They just want attention from their peers. So they need to learn the appropriate ways to interact with that peer. And this is a great opportunity because we have many opportunities for them to work on this skill throughout their day with us. I just want to take a little side note. We talked a little bit earlier about the requirements to be a part of the program outside of the expectations of having a functional behavior analysis and the diagnosis. We also do, because this isn't a program working on skills at the learning center, so we do have a 20-hour minimum. So they could come 4 hours a day. We can work with you and help you with that scheduling component as well. So now we want to move on to older kiddos that are 30 to 48 months. So their group skills are going to look a little bit different. They should have those previous skills. If they don't, that's okay. That's where we start. This is just our guideline for developmentally where they should be, where we want to get them. So a group skills, using a toilet and washing hands with verbal prompts. Instead of somebody being in there with them and helping them pull their pants up and down, we want to get them to where they're as independent as possible for toileting. They do not have to be toilet trained to start the program. That is something that we can assist with while they're here. Also following 5 different directives and responding in a group. So that circle time again, we're now giving directions because we're going to stand up. We're going to do movements for songs. We're also going to be asking questions. Who's wearing a red shirt today? Who has on white shoes? Who has a character on their shirt? That's a great way for us to also to bring in those preschool concepts with colors and shapes and sizes. Where they're going to learn, they want them to learn new behaviors by observing others. So if they see how one child might play with a toy, then that child leaves and your child may have never played with that toy, but they just watched. So they want to imitate those behaviors. That's learning by observing. We really want that goal. That imitation goal is such a huge component. And then following classroom rules, little things like picking up and putting away items when you're done, sitting in the chair the right way, not on your feet. Little things like that. Throwing trash in the trash can. And then play skills for the 30 to 48 months, that they can engage in imaginary play with peers for 5 minutes. Maybe they're playing in the kitchen. Maybe they're playing with actual toys and with a dollhouse, that they can sustain that play for up to 5 minutes. And it's not parallel play where they're both playing with the kitchen. This means that they are interacting together. One is saying they're hungry, the other one's cooking their food, they're playing restaurant or kitchen or house, and there's interaction, and both learners are on the same page within the play. Again, our program would provide many opportunities in different ways for that to occur. Also independent play, so they are able to sustain their own play without interactions from others for up to 10 minutes. That's a goal I'm sure a lot of parents look forward to, because you can have, we know they can play with us for 10 minutes, sometimes within, like we said earlier, they went through many toys within that 10 minutes. This is playing with one item. They can play with it different ways. They may be playing at the kitchen, but maybe for now it was restaurant, but now they're pretending to wash dishes, and now they're pretending to bake, but they don't have anyone to feed. That's okay. That's their independent play for 10 minutes. And cooperating with a peer for an outcome. So like holding a box while someone else puts things in, working together to build a block tower, putting the train tracks together with another peer. Those are being cooperative moments with the peer. And again, we are able to provide ample opportunities for them to increase that skill with many different types of toys. So I'm going to go a little bit into what is a natural environment training. So we want to make sure that we are using the current environment, choosing items that are available within the learner's reach and within sight. So sometimes we might put some items up a little higher because we're encouraging them to request it and use their language, whether it's using an AAC device or vocal or sign language. We want to create those opportunities, but at the same time, I want them to have an enriched environment. So they see things that they need to ask for, but they also have a lot of choices that they can choose independently. I just got done talking about independent play. I want them to make those independent choices and to be able to engage in those activities as well. So we're creating an enriched environment, so it's very natural. Now that environment in our program changes every month. We rotate toys, we have themes, we're doing the best to create an environment that's creating this natural training. Where the activities we're choosing are going to be something that's theme related or something that's going to create work on their skills. So we might have games, something that takes more than one person to play with. So now we have to go find a peer to play with us. So our BTs, yes, they will play with them. They'll engage with them. They're a big part of their day. And they're a big part of making sure they stay happy, relaxed, and engaged. But at the same time, we don't want our BTs being the peers. We want the other learners to be the peer, right? We want to work on that social interactions. So big difference between trial teaching and NET. Trial teaching is very repetitive, back to back, multiple times in a row. NET is contrived, so I'm setting up the environment, but it's not overly repetitive. So they're within their program, they're going to have their own individualized ABA goals. So whatever their ABA goals are created in their treatment plan is their primary focus. And then the program, the preschool readiness program is where the environment that they're learning those skills. So we're creating this school classroom-like environment for them to work on their individual ABA goals. And with that, we want to make sure it's very natural. It's not sitting down. If I asked you to find the red one or a star or respond to your name, I'm not doing it 5-10 times in a row. What we use here at MeBe quite often is called first data probe. So we will run a goal and ask, okay, what's your name? How old are you? And either they got it or they didn't. And we're not going to ask them 10 more times right now. We're going to take the data. Did I have to prompt them or did they do it by themselves? Within the theory, what we're saying is if a child can respond correctly 3 days in a row or 3 sessions in a row, it's a skill they have in their repertoire. They've got that. We don't have to run it 10 times every day. They've got it. So it's not as repetitive as trial teaching. It's much more natural, which helps to create that very happy and relaxed environment where the kids are engaged. So we're going to talk a little bit about some school readiness skills, what is expected and how can the MeBe program create these opportunities. So we have classroom routines, putting items away in their cubbies, cleaning up when they're done, snack time and lunch time. So snack time and lunchtime, these are skills that we're creating very naturally for them to eat in a group environment. The expectation is not to touch the other person's food, that they sit in a group environment, they have their own food. Can they open their containers? Can they feed themselves? Do they eat with a fork? Can they open up that package of fruit snacks that mom sent with them? Because these are things that are going to be expected when they go to school, and the school might not know. And I've heard of stories where kids don't get a lunch for a couple of days because no one knew that they couldn't open it. No one knew they couldn't do the zipper on the lunch bag. They just figured the child was already done. We don't want that to happen. So it's just a natural opportunity to work on those. It's not something we're tracking. It's not something we're taking data on. It's opportunities we're creating for them to gain those skills. Transitions, walking with a group to different rooms. We have it set up to where they're not in one room all day long. They're not in there for 4 hours. They're usually in a room for anywhere from 15 minutes to 30 minutes, and then they transition to another area. So they're working on those transition skills. So what happens when you transition? You have to clean up the environment you're just in, and then you have to follow directions onto where you're going. Then you have to walk your body. Okay, that's kind of hard for some of our friends, for them to walk their body. They've got to walk their body to the next location, and they need to understand and recall where they're walking to. We do use visual schedules with the children, so that helps a lot with the transitions. Some of the transitions is also to toileting. We do have scheduled toileting times within our program. That doesn't mean they have to go during those times. And those are also great opportunities for extra hand washing throughout the day. So if they don't need to use the restroom, they at least get to have an extra hand washing during the day. But the toileting, so again, every child's on their own individualized plans. We have a framework in place, and they are working on their individual goals within that framework. So if a child is just learning to toilet, they're probably going to visit that toileting in the bathroom a lot more frequently than somebody who's already toilet trained. And then the group skills. What kind of group skills are we working on? We are working on sitting at circle time and participating in songs, listening to and attending to a book, answering questions within a group, and also playing with peers. A lot of times during the group, we practice taking turns and sharing. I might have a box and it's a mystery box and I'm pulling something out. And so then I pass it to the next child and they get to pull one thing out. Then they have to pass it to the next one. And it goes around our whole circle. So they're really practicing with their peers, and we're playing with our peers. Sometimes we play group games and they learn how to interact with a game in a group setting. It's one thing to play red light, green light with just your BT. It's another thing to play red light, green light with 4 to 6 other peers. It's a lot of fun. And I hope I'm not going through too fast. Again, I'm going to answer questions at the very end if we have any. So let's move on. What does a day look like? Here are some pictures of some of the areas we have. So typically our program does start at 9. Does not mean your learner has to start at 9. We do have some learners that start at 11, and we run and they have a similar schedule that starts at 11. We have some learners that start at 1 or 2 o'clock in the afternoon when we adjust their schedule. So this is a schedule for the morning program, but we do have other schedules. So of course, they're going to start off with free play. This not only allows them to get acquainted back into our environment, but it also allows our BTs to get ready to set up for session, because they do have to track all the data on their individualized programs. And this is a great opportunity for everyone just to kind of get settled in. Then at 9:30, they are going over to the group time. Again, group time is from 9:30 to 9:45. Some learners come right in there at 9:30. Some learners are coming in a couple minutes later and joining in. Some learners leave a little bit before 9:45. That's okay. And then we have our sensory room time. So we have a classroom, we have a sensory room, and we have an imagination room outside of the circle time area. So we have 4 different areas that the learners transition to. So we might have a group of 8 children, but 4 going into the sensory room and 4 going into the imagination room. We have them rotate through the different environments for one, so then one environment is not overly crowded and everyone gets to have a great time and opportunity to play with everything. And so, and also the more opportunities we have for transitions, the better. Transitions do seem to be a challenge for some of our learners. The more practice they get out of it, without making it trial-based and making it natural, it is our focus. So after they might be in the sensory room, then we're going to have our toileting time. So again, if a child is on a different schedule, that's okay. This is also if a child that is toilet trained and says, I don't have to go, we're not forcing them, but we're like, okay, that's fine. We're just going to wash our hands. Great opportunity to work on hand washing. And even if they have that skill, it's great. We're going to do it a couple of times during their day here. And then after the toileting, because they've washed their hands, we're going to go to and have snack. Everyone brings their own snacks. If you have food allergies, just let us know. We'll arrange seating accordingly for any food allergies that may be. And then after snack, again, they might eat faster, they might need more time, that's okay. They're going to go to the classroom. And this is where they're going to really work on their individualized goals. We do like to use the token system for that. It allows the child to know a clear start and end to when they're working on the individualized goals. Sometimes it is, a lot of times it is tabletop, but that's okay. It's a natural environment. We're in a classroom. Where are you expected to kind of be in the classroom? You're expected to be kind of sitting at the table working on your activities. So they're going to be working on their activities. They also get time to play. There's toys in the classroom. There's a sensory bin in the classroom. That's actually a picture of our classroom with a sensory bin in the corner. Right now it has a kinetic sand and dinosaurs. Here at MeBe, July is dinosaur month. And every month we also we focus on letters, shapes, and other preschool concepts. So this month in July, it is dinosaurs. So we're doing different letters for different dinosaur names. We're doing dinosaur songs. We're doing dinosaur arts and crafts, dinosaur games, with dinosaur stories. And then we're also able to incorporate a whole lot of concepts within that theme. So they're getting exposed to a preschool environment through that. When they're done with their classroom, then they can go to the imagination room. And in the imagination room, that is where we're going to work on that peer interaction. We're going to work on that pretend play. We can build the train tracks. We've got baby dolls. We can really work on some of those play skills. Again, we're going to have toileting. You'll notice our toiletings are scheduled right before our food break. So that is on purpose, so we can get those hands washed and then go in and have some lunch. So at their lunch, they're going to be sitting at the tables back in the classroom. We also have a kitchen area where they can eat lunch, so that way there's not too many people in one environment. Again, we want a happy, relaxed environment. We don't want a stressed out environment. So that is our goal there. And then after lunch, they're going to go back to the classroom where they may finish up on working on some of the skills that they have in their individualized treatment plans, or maybe they're going to play with some of the toys in the classroom, and then they're going to go back either to the imagination area or to the sensory room. And the final 15 minutes is free play. They get to choose which room that they want to go into. This also allows our BTs at this time to finalize their data, put in all their notes, and really end on a positive note with the kiddos. So this is an overview of the program. Like I said, this is just a sample. So it's not set in stone that it has to start at 9 a.m. They will go through similar rotations at different times that they start. We do have the capacity to open up several different classrooms. We have the one open right now with anticipating opening up more in the near future as need comes. We have the space available, so which is great. We're able to do that, and we're not limited in our capacity at this moment. That's why I really wanted to get this information out there to you guys to let you know that what's available. So I'm going to take a quick look to see if we have any questions in our chat. If anybody has anything that they want to ask me, now would be a great time to do that. And I'm just going to give it a moment. And we'll also look over my notes, make sure I hit everything I wanted to share with you guys. I probably could have brought in the visual schedules to show you. I wish I would have done that. I do encourage you to reach out and come for a tour. We are definitely open to having you come for a scheduled visit. You can pop in as well. We just might not be available to show you around, but you're welcome to contact us and pop in at any time. So I don't see any questions. I'm really hoping that, oh, I think I have one. Okay, so is the end of the day at 2 p.m. Or are we open later? We are open from 9 until 6. So it doesn't have to be that schedule. So if you have a learner that starts at 11, they could, then their 4 to 6 hour day could start there. So we only go until 6 o'clock in the evenings. We have the most availability right now to take new clients before 2 p.m. Great. Let's see if we have any more. Age range. So the preschool prep program, the age range is typically 18 months to 5 years old. I say 5 years old, so they could go to kindergarten. If they do not have the school readiness skills, then it might be beneficial for them to do the school readiness program to get them ready to going into first grade when they're 6, if they're going to go to a special day class or a charter school. I do suggest this is definitely for that preschool age or prior to preschool. We'll see if we have anything else. I'm going to stop share for a moment, see if we have any other questions. We do also take elementary age for after school. Right now, we just don't have the availability at our center, but we do have, but that fluctuates, as many know. So we are able to take your information. So if you do have someone that's a little older or already in school, we are able to accommodate them here at the Learning Center. if you were to put in your information at the website, and then we can get back to you, and we would touch base with you every 3 to 4 weeks until we get an opening and see if you're still interested. So just because we don't have a space doesn't mean we won't in the near future, and that could change quite quickly. Okay, I have a question. I have a 2-year-old. He's on the spectrum, but I was just wondering what's the difference between ABA therapy and preschool ready? Okay, so we are combining ABA with our preschool readiness program. So the preschool readiness program is the overall program that we have. So they are going through the schedule, we have the concepts, we have the themes, and all of that planned out. Then they have their ABA goals, and they are completing those ABA goals while they're in that environment. So if they're not quite talking yet, but we can do that, and we can work on those skills, the communication skills, under the umbrella of our preschool environment. So they're getting exposed and practice in a class-like setting. They would still go through the full process of getting their FBA and all of that through the insurance. That all stays the same. We're providing the added element of working on those school readiness skills. So if they came as early as 2-3 years old, the idea is they're going to be ready for a preschool if you want them down the road to go to your public school. I'm going to give a minute to see if anybody else has any other questions. I should have done this on a GoPro. Could have taken you guys on a tour. All right. So, but since I can't take you on a tour, I do encourage you to come on over and or call us and schedule one. I'd love to take you, show you around, and you can bring your child as well. You can come alone or bring them with you. All right, it looks like I've answered the questions. I'm not seeing any more come in. If you do have questions down the road, please contact us and I will get you the answers as soon as I can. I hope everybody has a wonderful evening, and I look forward to meeting some new friends. Have a great day. Bye-bye.